Senator Davis, let's start off with the congratulations as Legislator of the Year. Thank you so much for what you do for our community.
Thank you very much for that. I appreciate it.
Now, I understand, as you told us, you've been in about 28 meetings this year. I've read that you are knocking on doors, even in new neighborhoods, to let them know what our legislation's about and to get their feedback. So what are some of the commonalities of feedback that you're hearing from all these people you're meeting?
Yeah, over the last 4 months, I have been going door to door in the new neighborhoods. There's so many new people that have moved into my district the last few years who don't know who I am. Also trying to meet in community meetings with groups of 20, 30, 40 people at a time. And so I'm doing it primarily because once 2024 starts, the legislative session starts, and we're in the election season, my opportunities to interact with constituents has greatly diminished. So I'm using the fall to make those connections. And what I'm hearing most of all is a lot of gratitude and thankfulness that their legislators taking the time to speak with them. But what I hear from them is do you guys fight in Columbia as much as they do in Washington, D.C.? Is there more civility up there? Are you solving problems? And what I assure them is Columbia is not Washington, D.C. I mean, look, I'm a Republican, I'm a conservative, but I have Democratic friends, and I don't consider them the enemy. And good legislation comes from people with good ideas and who are smart, and that sometimes comes from the other side of the aisle. So I tell them there is civility up in Columbia, and we do problem solve up in Columbia, and I think that's evidenced by the legislation we pass.
I thought it was interesting that you mentioned in your presentation that the seniority of our representatives that are there, our senators, is really helping our cause in the state.
We have in Beaufort County just an incredible delegation. I mean, we have more committee chairmanships in Beaufort County than any of the other 45 counties throughout the state. I mean, Weston Newton, my colleague, is chairman of House Judiciary Committee. Shannon Erickson is chairman of House Education Committee. Bill Hug-Persman is vice chairman of the House Ways and Means Committee. Chip Campson is chairman of Senate Fish, Game, and Forestry Committee. I'm the chairman of the Senate Labor, Commerce, and Industry Committee. So, I mean, these are all very important positions, and it allows us as representatives of Beaufort County to really advocate on behalf of our constituents in Columbia.
Well, let's hope this is going to work, because you outlined for us today that you have 6 priorities for 2024. You spend a lot of time here in Sun City with us. You know us. Of all those 6, which do you think really you're hoping for that impacts our kind of demographic?
I need to bring some further relief in regard to our road system down here. Whether you're talking about Argent Boulevard, which is extremely dangerous, more signalization for more points of ingress and egress into Sun City, a widening of roads in general, repaving. It's just too dangerous out there. And you've got people taking their lives into their hands, pulling out into medians and trying to hit brakes in traffic, and it's just too dangerous. So I think the #1 priority is continuing to bring some state dollars down to assist with those highway improvements. And I think the second thing I would say is we need to do something about controlling overdevelopment and the taking down of trees and cutting in of lots and building of homes and just simply increasing densities. We've already got a road system that's extremely burdened. Quality of life is already being diminished as growth occurs, and so we really need to get our arms wrapped around that. The green space law that was put into place, collecting a penny for a 2-year period to raise $100 million to purchase up green space. I think that's going to have a material impact, and I hope that the people of Beaufort County see some value in that, because I want to go back in future years and renew that penny sales tax, 35 to 40% of which is paid for by tourists. And so if we don't do something about it, we can sit back and do nothing and let the number of rooftops in southern Beaufort and southern Jasper County double. And just stop and think about what your roads would look like and what our environment would look like if we double the number of rooftops. We can't let that happen.
Right. Well, thank you for the initiatives you're taking. Thank you for taking the time to visit with us today.
Yes, ma'am.
Welcome to the Low Country Happenings, and I'm going to introduce an individual that I probably need not introduce because everybody knows Senator Tom Davis. But what you may not know, he is the Legislator of the Year.
Great to be here. I appreciate the introduction, Joe. Thank you, Tab, for the invitation.
You're always welcome.
And I think I've been doing this now, by this I mean talking to constituents, for the last 2 months. This is my 28th meeting. Because once 2024 gets here, can y'all hear me? Is this hot?
You're okay?
Okay.
Yeah.
Once 2024 gets here and the legislative session starts and the election year begins in earnest, I'm not going to have as much of an opportunity to interact in this way with constituents. So the last 3 months of 2023, I made up my mind this is what I was going to be doing. So thank you for the opportunity. And this time around, instead of just talking in theories about what my approach to government is and what the proper role of state and society is, I wanted to get into specifics, into things that I actually did on your behalf up in Columbia in 2023. I want to go through specifically how we went about spending your money, your state tax dollars, in some detail. And then I want to talk about some things in 2024 that I hope to accomplish. Again, very specific things. And so out of that maybe will come sort of how I approach things in Columbia, how I assess the issues, what values I bring to bear, what the process is like, and give you a better idea of just how things occur up in Columbia. So. And after all of that, we can then open up for any questions that you all might have of me that I didn't cover. And so you all should have this 8.5 by 11 sheet of paper, which is sort of been the format that I've used over the last couple months. I refine it as time goes by to make it more precise and more specific. So I think it's a pretty good worksheet for us to work from. The first 5 items that you see on this sheet are pieces of legislation that I either drafted or I was put in charge of getting passed as the floor leader in the Senate. So there were about 100 or so bills that were actually passed this year in the General Assembly and signed into law by Governor McMaster. I selected out 5 of those bills because I was involved in drafting them or I was put in charge of getting them passed. Okay, so that's how I selected these 5 things. The first bill you see on there is S381, and S stands for Senate. A House bill would have H as a prefix to it. So S381, which means it was the 381st bill filed during the current legislative session. So that's what S381 means. That particular legislation was the ratification of an amendment to our state constitution that increased the amount of general reserves or savings accounts we set aside as a rainy day fund in South Carolina. We used sort of like a household would do. You have a checking account and a savings account, and then maybe you have an account that will cover unforeseen things or things that you don't expect. I mean, it's sort of a rainy day fund. We used to have a requirement in South Carolina that 5% of the general fund be set aside as general reserves. And when I say the general fund, that's the annual amount every year that you pay in taxes that the General Assembly spends. Okay, so this last year we had $12.5 billion in the general fund. That's the amount of state taxes you paid up there. Doesn't count federal taxes, doesn't count local money, it's purely state dollars. So when I say general fund, that's what I'm referring to. There used to be a requirement in the state constitution that 5% of that general fund balance be put into general reserves. So if $12.5 billion was the general fund this year, 5% of that would have been about $600 million that we would have had to set aside and put into reserves. This legislation that went to my committee and that I was in charge of getting through the Senate increased it from 5 to 7%. It also looked at a capital reserve account. The requirement used to be 2% of that general fund balance. This legislation that I was directed to handle increased it to 3%. So what does that mean and why is that important? Well, we were told by the credit rating agencies that if South Carolina wanted to maintain its AAA credit rating, which means we could borrow at the lowest possible costs out there in the bond market, we had to increase our reserves, make ourselves more financially solvent. And so that's why this legislation increased the reserve requirement, general reserves, from 5 to 7%, and increased the capital reserves, which is money set aside for large projects, from 2 to 3%. And so South Carolina is an extremely conservative state from a fiscal standpoint relative to other states. I mean, those general reserves of 7% now and capital reserves of 3% is very conservative fiscally. We also have a requirement in our Constitution to balance our budget. We can't spend more than we take in. And we also have a very strong bias towards paying cash for large projects as opposed to borrowing. So I want to emphasize all those things so that you understand why South Carolina has a AAA credit rating, because we are very conservative fiscally. And so that's the reason for the first bill I have on here, so you all understand that. You may hear about states like Illinois or California or New York who are insolvent in some respects, in terms of their unfunded liabilities, or in terms of their debt, or in terms of any other matters. South Carolina stands in contrast to that. And I think that's especially important to emphasize, given the increasingly precarious position that the United States is in terms of our federal debt and federal deficit. The stronger we are as a state, the more we're going to be able to weather the tough economic times ahead, okay? So the second bill I have on here is S-108. It's a first responder death benefit bill. That bill was drafted by me, and it was a result of recommendations to me by two retired law enforcement officers in Hilton Head, Jim Fitzgerald and Sheldon Epstein. They were law enforcement, I believe, in New Jersey for many years, and then they retired and came to South Carolina, and they've joined this Retired Law Enforcement Officer Association here in Southern Beaufort County. They came to me 2 years ago and pointed out that South Carolina did not have a death benefit provision whereby if a law enforcement officer was killed in the line of duty, the family received a death benefit from the state. And they asked me if I would draft legislation that would provide that. And so I drafted a bill that provided for a $150,000 death benefit to be paid to the family of a law enforcement officer who was killed in the line of duty. This is an example of a kind of bill that was very popular up there, and other state senators, I think every other state senator, became a co-sponsor of the bill. And it's also an example of a bill that, as it made its way through the process, the committee process in the Senate and then over in the House, it got broader in terms of scope. In addition to law enforcement officers, it was amended to include firefighters who were killed in the line of duty, and also volunteer firefighters, and then finally EMTs, because it was recognized that all of these individuals put themselves in harm's way or put themselves in danger for the benefit of all of us in society. And so when the bill finally passed in May, it had been transformed from a law enforcement death benefit bill to a first responder death benefit bill. And it was signed into law by Governor McMaster in May. And I've had the opportunity, a bittersweet opportunity on 3 occasions since then to talk to families who actually have then lost a loved one in the line of duty and were paid this death benefit. And I got to share that news with them. This legislation is important not only because it's the right thing to do for obvious reasons, but to emphasize this: the way a state expresses what it cares about and what it values is how it decides to spend your tax dollars. And the fact that South Carolina has a program like this in place, I think, speaks well of our state and recognizes what these individuals and their families sacrificed and put on the line for the sake of a civilized society. So that's why I included that bill in the 5 in this summary here. The third one, S-164, is a repeal of the Certificate of Need. And that was legislation that I was put in charge of in my capacity as a subcommittee chairman in medical affairs. How many of you all know what a Certificate of Need is? Okay, 1, 2, 3, okay. Well, I'll give a brief background on it. Back in 1974, Congress passed a law that said to each of the 50 states, if you want to continue to receive Medicare money from the federal government or Medicaid money from the federal government, you have to pass a Certificate of Need law. And what a Certificate of Need law is this, is that if you're a health care provider, or you want to be a health care provider, you want to provide health care services to the public, or you want to buy medical equipment to provide health care services to the public, you can't just go out there and do it. You've got to go first to the Department of Health and Environmental Control in South Carolina and get a permission slip called a Certificate of Need, which confirms that there is a need for that kind of healthcare service down in your particular area. So in other words, it's not a free market, open market. You can't just go out there and invest your money and provide healthcare services, even if you're qualified as a doctor or a nurse or whatever. You got to get that permission slip from the state government first. That's what a Certificate of Need law is. The federal government, back in 1974, when they passed that law, thought that was an effective way to control healthcare costs. Now, they found out by 1982 that that wasn't controlling healthcare costs, and so they repealed that requirement. But by then, you had 50 states that had Certificate of Need laws, right? Because they had to pass them in order to keep getting that Medicaid and Medicare money from the federal government. And once you put that law in place in the 50 states, it became very difficult to get rid of it, because once you have healthcare establishments in a state which has that valuable piece of paper, that Certificate of Need certification, They don't want the law to go away because it prevents competition from coming into their space and offering competitive services. So if another provider wanted to provide services in an area where a hospital or a medical provider already had a certificate of need, they had to go to DHEC and try to get a certificate, and the existing provider inevitably would go up there and contest it and say, you don't need to give a certificate to this entity here. We're willing to expand our services, or we'll buy that piece of equipment they want to provide, or we'll add more beds. And so it really stifled competition in the healthcare provider space. And even if a provider was successful in getting that certificate of need from DHEC, the existing provider who already had the certificate of need would appeal the issuance of that certificate and tie it up in court many times for an excess of 10 years. So it was very difficult for competition to come into the space as a result of these certificate of need laws. Now, since Congress repealed the requirement that states have CON laws, 12 states have managed to repeal those certificate of need laws. And so we can look at those 12 states and we can see what the results have been as a consequence of repealing their CON, their certificate of need. And what you see in those 12 states very clearly from empirical data is an increase in access to health care and a decrease in health care costs. And intuitively, you can see why that would be the case, right? Because if providers of a service have to compete in regard to providing the service, and if a patient has choices among providers, that particular dynamic will lead to lower cost at a a better product at a lower cost, because that free market dynamic has demonstrated that across our economic sector. So we can see in the 12 states that that's been the effect. But still, it's been hard in South Carolina to get the CON law repealed. And I've been trying, or been part of an effort to try, ever since I was the governor's chief of staff back in 2004. We've been trying to repeal CON. We haven't been able to do that because of a phenomenon known as concentrated benefits versus dispersed costs. And let me tell you what I mean by that. Whenever you pass a law that creates benefits or confers benefits upon specific individuals or entities, concentrated benefits, they can then organize and hire lobbyists and lawyers and make political donations and can, lobby to keep that law in place. But the costs of that law, which are higher costs and decreased access, are dispersed among the people of South Carolina in general. And it's very difficult for them to organize in that same way to try to get the CON law repealed. So that's just it's very difficult to repeal a law that benefits a very certain select few that are very powerful. But we did repeal it. I was put in charge of this legislation in the beginning of 2023, asked by the President of the Senate and by the Chairman of Medical Affairs to get this through the Senate, to get it through the House, and get it down to the governor, and we did. We got it done the last day of session, and it was signed into law. The repeal was signed into law by Governor McMaster in mid-May. As a result, we have seen millions of dollars flooding into the healthcare provider space now, particularly into rural areas that have been underserved because hospitals don't exist out there. So this is an example of how you can overcome even strong institutional resistance to a bad law if you've got facts on your side and if you pound away and you make the case and you persevere. So that's an example. Sometimes we tend to think that the forces that want certain legislation to remain in place are too powerful, that even the truth can't overcome it, or even the facts can't overcome it. This is an example, however. We became the 13th state to repeal their CON laws, so it can happen, and that's why I selected that bill as an example. The last bill I have on here is S399, which is a bill that the chairman of the Finance Committee put me in charge of, which is taking the Department of Environmental Control, which is a huge state agency, and dividing it into two separate cabinet agencies, the Department of Public Health and the Department of Environmental Services. And that was signed into law by Governor McMaster in June. And the work on this one is not yet done because on the Department of Public Health side, we're now looking at the several state agencies that provide public health services, and we're consolidating them under the Department of Public Health, Department of Disabilities and Special Needs, Department of Mental Health, Department of Health and Health and Human Services. We're consolidating to eliminate unnecessary FTE overlap, full-time employee overlap, and to increase efficiencies in delivery of public health services. So this is an important piece of legislation to point out that when you talk about increasing access to health care, and providing better services, it doesn't always mean more money being expended. It means that your organizational agencies that provide those services are more efficiently structured. So that's why I singled that particular legislation out. Next, I want to go into how we spent your tax dollars this last year. The way we start out every budget cycle in January, the Board of Economic Advisors, which is a state agency of economists, they look at what the general fund projections are going to be for our next fiscal year, and they certify the revenues that we can appropriate. They tell us how much money they anticipate us receiving, and that's the figure we budget from. This year, we were told in January that we were going to have $12.5 billion in state funds available to appropriate in fiscal year 2023-2024. It goes from July 1 through June 30. So that's the number we start with. That's not federal money that comes down that the state distributes, and of course it doesn't count local money that the counties and municipalities. It's purely state dollars, the sales taxes, income taxes, corporate taxes that are paid up into the general fund in Columbia, and this year it was $12.5 billion. Now, starting the process, remember I said we now have a 7% general reserve fund requirement. It used to be 5%, now it's 7%. So you got to take right off the top 7% of that general fund balance and put it in that, make sure it's in that general reserve account. That means that was $715 million we had to put in there at the very start to make sure that 7% requirement was met. Same thing with the capital reserve account. We had to take 3% of that general fund amount and put it in the capital reserve account, and that translated this year to $390 million. So the very first things we do is after the revenues have been certified at $12.5 billion, we go ahead and make sure 7% is set aside for general reserves, 3% for capital reserves. The next thing we do is pay for property tax relief that was provided back in 2007. Now, I wasn't in the General Assembly in 2007. I was still the governor's chief of staff. But what that law did in 2007 was this. It said to the 46 counties, you can no longer tax primary residences to pay for school operations. Okay? We're going to take that off property tax bills for primary residences. And instead, we're going to take the state sales tax, which is 5%, we're going to increase it to 6%. That's going to raise about $1 billion a year, and we're going to distribute that $1 billion down to the counties to hold them harmless for no longer being able to tax primary residences to pay for school operations. Okay? And so essentially it's a tax shift. You're taking taxes off primary residences for school operations, and instead you're putting it onto a sales tax by increasing it from 5 to 6%. So, but what's happened since 2007? Well, more residents have been built, right? More homes that counties can't tax to pay for school operations because of that law that was passed. And so you have an increased need for the state to reimburse the counties for the inability to tax primary residences. Okay, so we had to pay an additional $795 million this year, again, to keep the counties completely whole, to make them whole for having taken away their ability to tax primary residences back in 2007. So you can see from the very start here, we started with $12.5 billion. We took $715 million, put into general reserves, $390 million put in capital reserves, $795 million was sent down to counties. So no money has been spent on any services yet, and big chunks are being taken out of that $12.5 billion, okay? So the rest of the general fund, except for $700 million, and keep that $700 million in the back of your head for a moment, but the rest of the general fund is then spent on the following categories that I have listed on here. 36% goes to K through 12 public education, 10% goes to higher education, colleges, universities, technical schools are included in that as well. 27% goes to healthcare and social services. 11% goes to public safety, and that includes law enforcement, and it also includes correctional facilities. And then the remaining 16% goes to all the other agencies. And I don't mean to short circuit that 16%, but this would be 30 pages long if I broke down where the rest of that 16% went. And I just want you to get a general sense of where your money goes, okay? Now, what about that $700 million that I told you to keep in the back of your mind? That $700 million goes for what are known locally as, colloquially as local projects. Or you might have heard them referred to on the news as earmarks. There are specific lines in the budget for specific things that money is dispersed for. I came out of administration in the governor's office when I was in the governor's office that hated earmarks, okay? Hated those sorts of things. Hated the legislature putting line items in the budget for local projects. And so my first year in the Senate, I hated them too. And I just went up there and I railed against them on the floor of the Senate. I said this wasn't what we were supposed to be doing. And Beaufort County didn't get hardly any of that money. In fact, it got very little of it. Historically, Beaufort County has gotten very little of that money. A few years ago, when I became a member of the Senate Finance Committee, I changed my approach in regard to that money. Because what I learned in the several years I'd been in the Senate is, by not going after any of that money, it didn't save the taxpayers anything. It just meant that more money went to Greenville and Spartanburg and Columbia and Charleston and Myrtle Beach and Rock Hill and Aiken and the rest of the state. They divided up what we didn't go after. And so in recent years, I've been going to the counties, that Joe's the county council chairman, or I've gone to Jasper County Council, Hardeeville, Hilton Head, Bluffton, Beaufort, Port Royal, Yemassee, and I've asked them, what are your priorities? What sorts of things are important to you? What projects are you working on that you would like assistance with? And then working with my delegation members, we winnow that list down and we decide upon certain projects we're going to try to get funded for Beaufort and Jasper counties. And this past year, $36.7 million of that $700 million went to Beaufort and Jasper counties pursuant to those requests. And to give you an idea of the rough equity of that allocation to us, think of it in these terms, and I came up with this math. In Beaufort and Jasper County, there are about 221,000 people, okay? So take that number as a numerator, and then as a denominator, take the total population of South Carolina as a whole is 5.2 million. So it's about 4.25% of South Carolinians live in Beaufort and Jasper counties. Now look at the amount of money we got out of that $700 million. Take that $36.7 million as a numerator and the $700 million as a denominator, and that comes out to 5.67%. Okay, so our population is roughly 4.25% of the whole, and we got 5.67% of that discretionary appropriations of the $700 million. So we're punching a little bit above our weight now in Beaufort and Jasper counties. And that is primarily a function of the fact that Beaufort County has more committee chairmanships than any other county in this state. I mean, we have a lot of seniority right now up in Columbia. Weston Newton is chairman of the House Judiciary Committee. Shannon Erickson is chairman of the House Education Committee. Bill Herb Kurzman is vice chairman of House Ways and Means Committee. Chip Campson is chairman of the Senate Fish, Game, and Forestry Committee. I am chairman of the Senate Labor, Commerce, and Industry Committee. So we have a lot of seniority in committee chairmanships, and that translates into influence when it comes to appropriating funds in Columbia. And sort of to assuage my guilt over going after earmarks, you know, sort of in a grubby way that I've always kind of looked down on, I have listed for y'all in 10-point font, not so you can't see it, but so I can fit it on one piece of paper, where all that $36.7 million went to. So you can see exactly the lines that were in the budget and where that money went. Next year, I mean, already we're starting to hear from Beaufort County and Jasper County and the municipalities as to what their items are for next year. And I'll go through the process all over again. But I've just made the decision in my mind that one of my obligations as your state senator is to be a fiduciary on your behalf so that if they're going to spend this money, okay, if it's going to be spent on local projects, I need to do the best I can to make sure an equal amount of that money comes back and is repatriated to my constituencies. So that is a shift on my part. That's a shift from what I used to do. And the best I can do is give you my reasons for that shift. And we can talk about that later if you'd like, but we're going to continue to be successful in that regard in years to come because of our seniority now. And because of that, I like to point out this. When I first got involved in government as Governor Sanford's chief of staff about 20 years ago, a lot of discretionary money, and by that I mean beyond core functions of state government, went to Greenville and Spartanburg in the upstate. Recently, a disproportionate amount of it's been going to Charleston area, Berkeley, Dorchester, Charleston counties. The next 10 years are going to be Beaufort, Jasper counties years because of the seniority that we have and because of the needs that we have. So I'm really excited about our delegation's ability to deliver on behalf of Beaufort and Jasper County in the next 10 years ahead. So, you know, kind of put that in the back of your mind as we get into things moving forward that I'm going to talk about in just a moment. The first thing that I want to focus on next year, I've been focusing on for the past several years, and that's called zero-based budgeting. And let me tell you what I mean by that. The $12.5 billion that I said was certified this year by the Board of Economic Advisors that we had to budget for this fiscal year, we didn't fight over how to spend $12.5 billion. What we fought over was how to spend the additional amount we collected this year over what was collected last year. Because what we do every year to start the budget, every state agency gets funded at the same level they were the prior year. You start right at that number, and all we do is fight over the billion or $1.5 billion of new money that comes in and decide how to spend that money. Okay? That's not zero-based budgeting. What zero-based budgeting is what we did in 2009, my first year in the Senate. That year we had to do zero-based budgeting because in 2009 there was less money in the general fund than there was the prior year. Because in 2008 we had a recession and there wasn't as much economic activity, and we didn't have as much revenue in the general fund in 2009 than we did in 2008. So we couldn't just simply fund state agencies at the same level they were in 2008. We didn't have that much money. So what we required the state agencies to do was to rank all their programs in the order of effectiveness and justify their expenditure. And we lopped off the ones that really weren't delivering value for taxpayers, and that's how we went about balancing the budget. That's zero-based budgeting. Every single year, making an agency to justify every single dollar that's appropriated to it and to demonstrate to us that it is still serving a compelling state objective. And think about it in these terms. A company that didn't do zero-based budgeting would go out of business quickly, because if it just simply funded every department every year at the same level it was funded the prior year, I mean, irrespective of whether it was doing a good job or accomplishing what that corporation needed that department to accomplish, they wouldn't remain in business very long. That same budgeting discipline needs to be brought to bear to the South Carolina budgeting process. And I'm 14th out of 46 in seniority now. There's 13 people ahead of me. As I get more seniority, maybe I'll be able to go ahead and have what was done in 2009 done every single year. And let me tell you one of the benefits of that, one of the benefits of doing that. This year in the general fund budget, beyond increasing appropriations for state agencies, we made special increases in two areas, for roads and bridges and for classroom teacher salaries. Those were the two areas where we had a disproportionate amount of new money going into those areas. For instance, in regard to roads and bridges, we put $205 million of general fund dollars on top of the $2.5 billion in gas taxes that were collected. Now, gas tax revenues, state gas tax revenues, don't go into the general fund. They go right to the DOT or right to the State Infrastructure Bank for road purposes. They don't go to the general fund for appropriations. But what we did, because we want to accelerate those road repairs, is we stacked on top of that $2.5 billion, $205 million of general fund revenues. And for that reason, we've done that for the past several years. We've been able to go ahead and get I-95 teed up. That is ready to be widened in each lane, to each lane in each direction from the Georgia-South Carolina line, including the bridge, all the way to exit 8 and repaved. And that has been funded, permitted, environmentally mitigated. Secretary Hall at DOT has issued the RFPs for contracts, and at the beginning of next year, you'll start to see that those widening activities begin on I-95. By putting general fund revenues on top of gas tax revenues for roads and bridges, it helps accelerate our interstate repairs. I'm working now on getting from exit 8 to the Walterboro exits. Legislators in other parts of the state are working on the other interstate parts of the interstate system in South Carolina. Like if you're from Charleston area, you're interested in I-26 from Columbia from Charleston to Columbia. I mean, if you're in Columbia, you're interested in I-26 from Columbia to Greenville. Or if you're in the Midlands, you're interested in I-20 being expanded from Florence to Columbia to Augusta. Or if you're going up to Rock Hill, you're interested in from Columbia I-77 all the way up to Charlotte. So, and the upstate, of course, you got I-85. So by putting general fund revenues on top of the gas tax revenues, we can accelerate that statewide plan to improve our interstate system. Similarly, in regard to teacher salaries, classroom teacher salaries, we have a stated objective to try to get the average classroom teacher salary in South Carolina up to the national average. The national average is $70,000 a year. The statewide average in South Carolina is $57,000. So we have a ways to go, but that is a focus. If we have zero-based budgeting, okay? If we have every state agency, we make them rank their programs in terms of effectiveness, and we make qualitative decisions on what to fund, and if we lop off those things that aren't delivering value, that frees up revenues that we can then allocate to areas like roads and bridges and classroom teacher salaries that we consider to be relatively more important. So when you talk about increasing funds for roads or for classroom teacher salaries, that doesn't automatically mean you're raising taxes. It can mean you're just making better use of the dollars that are already being collected, and that better use is a consequence of zero-based budgeting. Okay, so that's what I mean by zero-based budgeting. The next thing I want to work on next year is something that I've been working on for the past several years, is reforming our energy generation markets in South Carolina. And let me explain what I mean by that. In July of 2017, there was a joint venture between Santee Cooper, which is a public power utility, and then SCE&G, which is an investor-owned utility, which has since been purchased by Dominion, but back then it was SCE&G. SCE&G and Santee Cooper pulled the plug on a joint venture to build a new nuclear reactor in Fairfield County, which is just north of Columbia, after spending $10 billion of ratepayer money that's still in your ratepayer base. They pulled the plug and walked away and said, we're not going to finish this project. Let's scrap on the ground. In the aftermath of that, a lot of us did a deep dive into how could this have happened? I mean, what's the reason for this? And what I discovered was that we've had the same system of energy generation in place in South Carolina for the last 100 years. What we did back in the 1920s is we divided the state up into 3 geographic regions, upstate, Midlands, and the Low Country, just very generally. And we assigned a utility and gave them a monopoly to each of those 3 areas. And we said to that utility monopoly, we'll give you a guaranteed rate of return on every dollar you spend on generating power. We needed to do that back in the 1920s in order to entice utilities to spend money in South Carolina to bring electricity to our state. We needed to do that because South Carolina back then, 100 years ago, wasn't a place where capital was readily invested. It just wasn't. And it worked. You have to give credit for that. It worked. But you can see the moral hazard associated with that, right? Because if you give a utility a monopoly in a certain territorial area, and you say to that utility, we're going to guarantee you a rate of return on every dollar you invest, you have incentivized that utility to pursue capital-intensive projects, very expensive projects, because the more money they spend on power generation, the higher the return they're going to get. They're guaranteed a return. There's no incentive for efficiencies. There's no incentive for new technologies. There's no incentive to go out there and figure out a new way, better way to do things to save money for customers. And so I never really realized before that the rate you pay for power is what needs to be paid in order to give that utility that guaranteed rate of return on the investment of their capital. It's not a function of what competition in power generation market dictates. It's a function of giving that rate of return to that utility. And so when we looked at what happened at VC Summer with Santee Cooper and with SCE&G, after the fact, what we found was 2 or 3 years prior to them pulling the plug in July 2017, they knew they weren't going to complete that project. But they continued to spend the money because they were getting a guaranteed rate of return on all those expenditures. And so in the aftermath of that, in July 2017, I drafted a piece of legislation called the Energy Freedom Act, which was passed and got signed into law by the governor. And what it said was this, in part what it said was this, that if you're an independent power producer, and if you can generate power for less than the avoided cost of the utility with a monopoly, or for cheaper than that utility, then that utility has to offer a power purchase agreement to that independent power producer for a 10-year period, at least 10 years. And that's important because the IPP can then use that contract to access credit markets to build the power generation. If that's the case, then they have to offer that power purchase agreement, buy that power at the cheaper rate, and pass the savings on to consumers. It was a first step toward competition in energy production markets, okay? And I think that's what we need to be doing moving forward, is bringing more creativity, more entrepreneurialism, more innovation, more technologies, more competition to that energy generation sector. A lot of other areas of the country have done it. We, by and large, have remained a vertically integrated monopoly, and we're moving away from that. And so I did that legislation in 2019. I followed that up in 2021 with a broader look, a market study that I chaired, looking at, do we need these territorial jurisdictions at all anymore? Should we open up energy generation markets to competition across the board? Would that spur more innovation? Would that attract more capital investment? Would that lead to more technologies? Would that lead to more renewable powers? Would it lead to more, natural gas or nuclear? Or so this is an ongoing effort, and it's illustrative of a general thing that I bring up in Columbia to the public policy debate. And if you want to know anything about my approach to public policy, it really starts with this: that whenever you've got competition in the provider sector on the supply side, and whenever you have choices on the demand side, the consumer side, you're going to get a better product at a lower cost. That market dynamic will lead to efficiencies and capital allocation. So this is an attempt to do that in the energy sector. Okay, I started it in 2019. I hope to continue it next year. I want to do the same thing in healthcare, bring that same sort of free market principle competition into healthcare. Now, what does it look like in that context? Well, in that context, it looks like this. On the supply side of the equation, I want to increase the number of providers. I want to increase choices for patients. What does that mean? Well, 5 years ago, I drafted a piece of legislation called the Nurse Practitioners Act, which it looked at what state law allowed nurse practitioners to do. And what I realized was 5 years ago is that state law only allowed nurse practitioners to do about 70 to 75% of what they are trained to do in schools, because the statute defining what nurse practitioners can do was passed back in the 1970s and was never updated to account for the increased opportunity or increased competency they have now based on what they're taught in school. So the legislation I filed 5 or 6 years ago, but it's a blur now in my mind, I think it was 6 years ago, it synced up what the statute allows nurse practitioners to do with what they're actually trained to do in school. Now, you don't want to have nurse practitioners doing things that are beyond their competency, but you want them practicing to their full scope of competency. And so that law got passed 5 or 6 years ago. And that law also repealed a requirement that said a nurse practitioner cannot provide health care services outside of a 45-mile radius of where a supervising physician is located. And that was put into law back in the 70s because if a nurse practitioner encountered problems, it took a doctor a while to drive out to where that nurse practitioner was to lend a hand. Well, now you don't need that because you got telemedicine, you got iPhones. And so we eliminated that restriction because if you look at where most physicians are, they're in urban areas like Charleston or Columbia or Greenville. And if you draw that, sort of like a protractor, if you draw a 45-mile radius around where that supervising physician is, nurse practitioners couldn't get into rural areas. I mean, by law, they were unable to provide their health care services. So the law that I drafted 5 or 6 years ago synced up scope of practice with what they're trained to do and eliminated that 45-mile radius requirement. And as a result, we have seen nurse practitioners going into rural areas and for the first time providing some primary health care services to the rural communities who in essence were going without and just going into the emergency room whenever they had a problem. So it has really made a difference in terms of access. I did the same thing the next year when it came to physician's assistants. The same thing, syncing up their scope of practice with what they're trained to do, eliminating that 45-mile radius requirement. Again, this is increasing on the supply side the number of providers because you're increasing, the access to care and competition among providers, and you're giving more choices to patients. Again, that's the common theme in how I approach things up in Columbia, and that's what it looks like in the healthcare space. The next item I have on here about what I hope to work on in 2024 is called LCI deregulation, that Labor, Commerce, and Industry. That's my committee in the state Senate. That committee is in charge of overseeing all the regulations that relate to occupations and professions in South Carolina, what regulations they have to operate under. It's a huge agency, a huge committee. And so what I've taken to doing, and it's going to take me about 7 or 8 years to finish, is I'm looking at all the regulations in each section of the code and looking at the regulations and making sure that only those that actually protect the public are still remain in place, and that we cut out those that are simply there because they got put there at some time in the past. I'm subjecting all these regulations to that cost-benefit analysis because I'm not an anarchist. I agree we need to have regulations. I agree we need to protect the public, but you don't need regulations that aren't conferring a public benefit because all they do is drive up the cost of those services. And so I'm going through the code systematically, and as I say, it's going to take me 6 to 7 years to get there, but that is an ongoing thing so that when I'm not working on specific pieces of legislation, I'm working overall on reforming and making that regulatory process more efficient and not so burdensome. The next thing I want to work on, get done, and I touched on it some, our roads and bridges, and continue to advocate on behalf of our area to get DOT funds down here, to get State Infrastructure Bank funds down here. And for our neck of the woods right here, and for you guys, what that primarily means are alternate routes of ingress and egress from Sun City, okay, more traffic signalization, you know, at Sun City Boulevard in particular, out there on 170. Improving Argent Boulevard, what I think of as the triangle, okay? You've got Argent Boulevard as, think of it like a hypotenuse, and then you've got 170 and then 278. That forms a triangle. That is in desperate need of upgrading in terms of road widening, signalization, you know, medians, curb cuts, things of that nature. I mean, we need to improve that because every day it seems like there's an accident on that road. Every day it seems like, you know, and you know, it's bad enough that somebody gets killed or injured. That's horrible. But also the quality of life. I mean, it's a crapshoot driving from Beaufort to Bluffton. If there's a car accident, you can add 25, 30 minutes on top of it. And that is becoming more, you know, the rule, not the exception. And so when I talk about roads and bridges and focusing on that for you guys, that's primarily what it means. 170, 278, Argent Boulevard, better signalization, repaving. That's what I mean by that for this neck of the woods. I've already talked about I-95 and the efforts that we've made there so far in getting the first leg of the widening done, working on that second leg from exit 8 up to the Walterboro exits. So that's that. The last piece I want to talk about, and then we'll get to some questions, is the green space law that I drafted 2 years ago. And let me give you some background on that. I grew up in Maryland, and I saw what the development in the Mid-Atlantic region did to the Chesapeake Bay. It absolutely increased all the runoff and almost destroyed the bay. And they're spending hundreds of billions of dollars now trying to recapture what that estuarine system used to be, and they'll never get it. I see the same thing happening in Beaufort County that I saw happening in Maryland, particularly in the last 10 years. As I drive down 170, you know, going south, or, you know, drive on 278 going east, y'all see it. Y'all see thousands of acres being clear cut. You see roads being cut in, lots being staked out, and homes being built. Okay, it's happening before your very eyes. A couple years ago, I went to the planning department for Beaufort County, and I said, looking at southern Jasper County and southern Beaufort County, if everything that has been permitted, whether by development agreements or plan unit developments or by right zoning, if everything that's been permitted and not yet built comes to fruition, what would that look like? And they told me it would be, you'd be doubling the rooftops in southern Beaufort and southern Jasper County. Can you imagine our roads, which are already overburdened, what it would look like if we doubled the rooftops in southern Beaufort and southern Jasper County? Can you imagine the degradation to the environment that would occur, the runoff going into the streams and rivers and the estuarine system, and just the quality of life diminishment would be astronomical. And so what I did 2 years ago is I drafted a piece of legislation called the Green Space Act, which got signed into law by the governor. And it authorizes counties to submit to the voters for approval a penny sales tax for a certain period of time for the express purpose of buying up land and placing it in perpetuity as undeveloped open space, okay? And a covenant's placed on it so it's undevelopable from here on out, okay? That passed. I went to Beaufort County Council and asked if they would put it on the ballot in November of 2022. They did. The voters of Beaufort County approved it in November of 2022. That penny sales tax started to be collected in May of this year. Now, it doesn't apply to groceries, doesn't apply to medicine, doesn't apply to gasoline, the most regressive taxes. And about 35 or 40% of it's paid for by tourists that are coming to this area, okay? What was approved by the voters was for a 2-year period, there'd be a penny sales tax that's going to raise $100 million for the purpose of those open space, green space purchases. I have served on the Green Space Committee the past several months, putting in place the objective criteria that has to be used to evaluate parcels. It's a very transparent process. There's a forensic auditing requirement. There's a requirement that county council vote for 2 readings on any particular land purchase. It's a very, very transparent approach because I want the people of Beaufort County to see the value associated with this. I want them to see what they're getting for that money because, quite frankly, I want to go back in future years and do it again. because $100 million sounds like a lot of money, but in the scheme of things down here, it's not going to do the job if we want to preserve the sort of thing that brought a lot of us here to begin with. Now, I've gotten some criticism from some in my party by saying, Davis, I thought you were, fiscal conservative and you were against higher taxes, and here you are, passing this law that's imposing a penny sales tax for green space. My argument to them is just what I said to you in terms of if we don't do something, we're going to degrade our environment and erode our quality of life, but also this, if we don't do something about that growth, you're going to have an explosion in your property tax bills in years to come, because if you double the rooftops in southern Beaver and southern Jasper County, you're going to have to pay higher taxes for more schools, for more law enforcement, for more libraries, because that growth doesn't pay for itself. So I would argue that by having a penny sales tax, 35 to 40% of which is paid for by people coming into this area, tourists coming into this area, you're avoiding a huge property tax increase in the future. And so I do think it's fiscally conservative. And that's on top of the fact that it's the right thing to do. And if you want to get right down to naked economic interest, it's preserving your property values. Your property values as homeowners or landowners are going to be protected if we prevent our area from becoming like Mount Pleasant, where we're going to pave every square inch and we're going to load it up with cars and we're going to be sorry to be every town USA. We have something special here, and I wasn't going to sit by idly and do nothing, and at least this is something, okay? So that's my justification and rationale for getting that legislation drafted, passed, and enacted. Because, make no mistake, I drafted it, I pushed it through the system up there in Columbia, got it signed into law. I went before Joe and his colleagues at Beaufort County Council and convinced them to submit it to the voters. And then I went out to the voters and made the case for why they should pass it. So I own this thing. I want this thing to be successful, and I want people to see the value of it. So that is a summary of some things that I worked on your behalf in 2023 that I drafted or I was put in charge of. It's an overview of how we went about spending your tax money, and it's a snapshot of the sorts of things that I'm going to be spending time on in 2024. So with that, Tab, I will turn it back to you to ask anyone if they have questions, and I'll be happy to answer them as best I can.
Could you explain the use of ATAX funds? 15%.
Oh, I skipped that one. I'm sorry.
Yeah.
S284. It's on the top of the sheet, one of the 5 bills that I said I worked on. S284 was legislation that I drafted, and what it did was this. There is something in South Carolina called an accommodations tax, or it's often referred to shorthand as an A tax. That is money or a tax that's paid by individuals who sleep in hotels, okay, in establishments that offer rooming or overnight stays. There is a 2% statewide A tax revenue, and then there's up to 3% of local A tax revenues, okay, that can be assessed, okay? So 5% maxed in total on A tax revenues. Those monies are collected and distributed by the Department of Revenue down to the municipality or county in which the establishment was located that collected the tax, depending on where the hotel was. There is in the code, the South Carolina Code, restrictions on how that money can be spent. And the restriction says you can only spend those A-tax dollars on things that promote tourism. Okay, so it's a limited universe of things you can spend money on. So Joe and his colleagues in Beaufort County Council, or those on Bluffton Town Council or Hilton Head Town Council, they get these A-tax revenues, but they're restricted as to what they can spend that money on. My legislation that I drafted added workforce housing as a permissible expenditure of those A-tax monies. Now, it wasn't an increase in taxes, it was just an increase in the things that local governments can spend an existing tax on, okay? So I filed that bill, and it immediately got bottled up in committee by those that wanted to keep the money just for tourism promotion. Parks, Recreation, Tourism Director opposed the legislation. Certain chambers of commerce opposed it. And so in order for me to get the bill out of committee, I had to sit down with those stakeholders and say, okay, I see you guys got a hold on this bill. What can we do? We got to solve this problem down here. I got localities that are having difficulty. And so the compromise I reached was we capped out what local governments can use that A-tax money for workforce housing at 15%. in any given year. So they can't use all their ATAX dollars for workforce housing. They can use up to 15%, which quite frankly I didn't see as much of a concession because as a practical matter, no local government was going to spend 100% of their money on workforce housing anyway, nor do I think that would have been a good idea. So I was, okay, willing to say let's cap it at 15%. The other concession I had to make was this expanded use of ATAX dollars for workforce housing is only going to be in effect for 7 years. And after 7 years, I have to petition to get it renewed by the General Assembly. And it's my hope that it's going to be such a successful thing and that it's going to be such a successful tool for local governments in solving this problem that I can get it renewed. But this bill is an example of how in legislation or in public policy, you can't just be absolutist and purist. You're going to have to sit down sometimes and negotiate with some stakeholders who are powerful enough to hold a bill up. And in order to accomplish something good, you have to make some compromises sometimes. Compromise is not a bad word. Compromise is what takes place and ought to take place with legislation because nobody has 100% of the right ideas all the time. You've got to go into it with, okay, this is what I think the ideal is, and then you have to have an open mind and listen and make accommodations and adjustments to get things moving forward because at the end of the day, this is about results. It's about getting something done. It's not about being philosophically pure. So that's an explanation of, I didn't mean to skip that one because that's a bill I'm particularly proud of.
Yeah, I know you were.